Hello, ladies and gentlemen. My name is Gregory Lynn, and I'm here with Dr. Chad Sherwood, who is a urgent care medicine specialist. Can you tell us a bit about your journey into medicine and why you chose urgent care and family medicine?
So I have two older brothers who are ER physicians, and I started out thinking about medical school, but then changed my mind and went into teaching and taught school for 2 years before deciding that I probably need to go back to school and go into medicine. And so I ended up doing that, and then went into family medicine, and then did a lot of moonlighting, part with my brothers, and then went and joined them at the ER for about 4 years until I started the urgent care. And then I've been doing urgent care and family medicine since. So about almost 20 years in urgent care, family medicine, and then recently started doing a few ER shifts.
Wow, that's really great. How does urgent care differ in treatment and everything overall compared to like primary care or like even the ER?
So a lot of the ER before urgent cares came about was urgent care. But now that we have more urgent cares, it's not quite as much. But there's still a lot of people who go to the ER for urgent care because they don't have to pay anything.
Yeah.
And if they went to the urgent care, they'd have to pay something. So there's still a lot there. But, urgent care is typically walk-in. You don't have to have an appointment. Some urgent cares will do family medicine as well as urgent care. But it's kind of in and out stuff. And so they're usually quicker visits and usually acute care visits, not chronic management. But some urgent cares do chronic care management, which we do. But so it's a little different from both, but they kind of overlap
with each other. Gotcha. Now on to Sherwood Urgent Care. What kind of inspired you to create Sherwood Urgent Care?
So while I was in the ER at Cersei, again, a lot of what we saw you could handle in the clinic. It just really wasn't that complicated. And I was kind of at the point where I was getting tired of all the ambulance traffic and anyway. And so I thought it'd be nice to have a place where you could go and take care of so many things that we do in the ER without having the ER expense, because you go to an urgent care for a laceration and it may cost you $250 to $350, but you go to the ER for that same laceration or injury and it's going to cost you $2,500 to $5,500.
Gotcha.
Whether it's you or the insurance company or the taxpayer, whoever it is, it's going to cost 10 times more at the ER than it does at a clinic. And when I used to work in the ER, I used to wonder why everybody came for those type of things. But part of the reason is because their doctor didn't want to mess with it or didn't do it. And then part of the other reason was probably because they didn't have to pay anything. But it definitely gave people a lot more options instead of having to go to the ER for those things.
Is there ever a time where going to the ER is a better option, maybe for more extreme cases, I'm guessing?
So certainly true emergencies, you really ought to go to the ER. Heart stuff, you typically need to go to the ER because there's just things you can't do at an urgent care. Stroke type stuff, ER. Any significant trauma to the ER. Those are the main things. And again, knowing what an emergency is not always common knowledge. And so, but, Google can certainly help if you are not sure if something's an emergency or not. A dislocated joint is an emergency, and so that's got to be reduced. So, in the urgent care, I've done some shoulders and some fingers and toes, but they got to be reduced. And so sometimes we can't get them in the urgent care, and you'll have to go to the ER because we don't have sedative medicines and
Yeah.
stuff. But so all emergency should go to the ER, but specifically cardiac stuff, stroke,
stuff.
And significant trauma.
Gotcha. What were like some of the challenges that you faced whenever you did start Sherwood Urgent Care?
So I think kind of like any business, one of the challenges is funding. So
yeah,
getting money, that's definitely one of the challenges. And then the second challenge is probably just the business part, because when you go to med school, you don't get any kind of education on business or money or any of that, and so that's another challenge. And then managing people is always a challenge. Insurance companies are always a challenge, but usually you're going to have a billing department that does that. But if you have to do your own billing, that can be a challenge. But I would say those are the three biggest challenges: is financing, business management, and people management.
Was there like a lot of like paperwork that you have to complete in order to start it up, or was it just?
There's some. Becoming a business and filing all that kind of stuff, and then having a lab and having the appropriate paperwork for that.
Yeah.
And then your insurances, your malpractice insurance and all that stuff. So, and then employment, when you employ other people, you have to have some paperwork involved there. But yeah, so there's always paperwork involved. And as far as the patient side of that, you spend about probably as much time on paperwork as you do patient care.
Patients, really?
Mm-hmm.
Wow, it's
about half and half, yeah.
Really. Now on to like daily practices. What were some challenges that you faced in your career as a family medicine doctor?
Your day-to-day stuff that's challenging is just kind of dealing with patients, and sometimes the difficult patients, and then sometimes dealing with the insurance company who doesn't want to do the things that you feel like the patient needs. Those can be challenging. And then sometimes just not finding the right help for your patient, whether it just isn't there or they can't afford it. But that becomes a challenge.
What are like some of the most common cases that you do see on a day-to-day basis?
So your most common stuff is going to be your cough, cold, flu, COVID, strep throat, sinus stuff is probably the most common. After that is going to be your aches and pains, back strains, ankle sprains, those kind of things. So not a lot, but they straggle in. So I only work 2 days a week seeing patients in the clinic, but and so I haven't had one for a few weeks, but I had one the other day. So but the other folks that work more than I do in the clinic will see more than I do, but they kind of straggle in. You'll go through a spurt where you have a few more than usual, and then it'll.
You had a banquet that week.
That kind of thing. But it's kind of like flu. Used to flu, you'd only get flu during flu season, but now it's kind of a year-round thing.
Did you guys see like a large insurge of COVID patients whenever COVID did start to happen?
Oh yeah, whenever
What do you think?
it
obviously
first started. And the frustrating part with that is a lot of clinics in town wouldn't even see COVID patients.
Really?
Yeah.
Why was that?
Basically, they didn't want to
much
expose themselves and their staff to COVID. Which, again, if they were my doctor, I would say, okay, I need to find a new doctor.
Definitely. That's crazy that they would suggest that. Are there any like time constraints whenever you do see your patients? Or?
So there is, especially if you're busy. To make money, you have to see a fair amount of patients, and you have to do a good job documenting. And so to do all that and do a good job at taking care of them, it's always a challenge to do each one of those well, to take
Yeah.
good care of them, to make them feel good about the care they're getting, to do a good job on the documentation so that you get paid, and to get as many people as you can in and out so that you see enough to make a profit. That doing all that together is a challenge.
Yeah, definitely. And I'm guessing it gets better with time.
Sure, you get
Yeah.
more efficient, your staff get more efficient, but it's kind of a constant challenge. And then, during spring and summer and fall, you'll have those slow days where you don't have a lot of folks. And so when you're the owner, that kind of creates some anxiety. Like,
Yeah, there's not.
I've got 10 people sitting here and no patience.
Yeah.
And you're like, we need some patience.
Yeah.
But yeah, so it's a challenge.
Also, just like a little fun question. What's like the craziest patient story that you have?
So there's a lot of those. Some aren't real appropriate, but people that stick things in places where they shouldn't. But gunshot wounds that are the most craziest things that you can imagine somebody doing, pulling on the end of a gun that's loaded without a trigger guard, or those kind of things. But the other day I had a lady in the ER that drove from Virginia who came to see her boyfriend, who she hadn't talked to in 4 years. Come to find out. But her and her boyfriend evidently communicate telepathically.
Oh. Okay.
So you get a lot of psych in the
Yeah.
ER, which I guess that seems to be more now than before, or maybe that's just Jacksonville, but
yeah.
a lot of psych and a lot of drugs.
Oh.
You just wouldn't believe, I don't know, 50 to 70% of the people, if I tested them, would be positive for something.
Something underneath. Yeah, that's insane.
Like a tox screen.
Yep.
Yeah.
It's crazy.
For like the gunshot cases, do you usually send them to the ER app, or like are you able to solve it?
So the gunshots, yes, usually go to the ER. I've only had one in the clinic, and it was a little through and through in the calf, and so it wasn't a big deal. But yes, gunshots almost always go to the ER, and sometimes they're not so good. I had a 14-year-old the other day that had a gunshot wound in the chest and didn't make it.
Oh.
So yeah, they're.
So the camera can pick it up.
How often is it, just stupidity versus actual crime when it's a gunshot wound?
That's a good question, but I'm going to say 25 to 50% stupidity. Yeah.
Yeah.
So that is a lot of crime, though.
Yeah, it's a lot of
more than,
crime.
like, expected. Yeah. For like, onto patient education, like what should a patient know that makes it easier to treat them?
So ideally, they would know what medicines they're on, what they're for, how many milligrams, how often they take them, what pharmacy they use, just kind of the things you would think most people would know. Certainly makes it easier. Their family history, but for sure their medicines and their diagnoses, what they take their medicines for.
Yeah.
Can I add on to that?
Go ahead.
I don't know if you've ever seen the show House
Yep.
MD, but how often is it that patients like lie or like don't tell you a medication that they take and it causes issues for you?
So I wouldn't say often, but it happens. And your underlying thing is that you believe patients, because if you don't believe them, then it makes it hard to make any decisions, right?
Yeah.
But on the other hand, there's some things like pregnancy, for instance, that you don't ever believe them. And so there's some of that, both of that. But when a female has abdominal pain, I'm always going to, if she still has her parts and she's between 10 and 50, I'm going to get a pregnancy test every time, because just because they say they're not sexually active doesn't mean they're not sexually active.
Yeah.
Or just because they're there's no chance I'm pregnant, doesn't mean they're not pregnant. Or because they're on their period doesn't mean, it's just if they got their parts and they're between the ages of 10 and 50, if they got belly pain, I'm checking a pregnancy test. I don't care why. But on the other hand, if they tell me they've had a fever, I'm going to assume they've had a fever, because if I assume they don't, then that's when I get into trouble.
Gotcha. Yeah. onto like, so I was going to ask a question relating to like how often you see like heart related things, but you did say that most of the time they go to the ER for that.
Most of the time they do. We still see a fair amount of, quote, chest pain in the clinic. Most of those aren't significant.
Yeah.
But we do get a few MIs in the clinic. We had one the other day that they saw and sent to Little Rock and had stents. And so we get some, but if they're having significant issues when we get them, then we get them out pretty quick and send them to ER so they can get some help.
Gotcha. Do you guys ever work with like other, I guess, professions and different things, or is it mainly like just like sending information to them, or how does that kind of work?
Like specialists, you mean?
Yeah, for specialists.
So we refer a lot of people to specialists. So, ortho, cardiology, neurology, psych are some of our main ones that we refer to, occasionally rheumatology, therapy.
Yeah.
But yeah, so we set up the referrals, and then we do send them information that we have about the patient, so they have, their information and what to go on, medicines, diagnosis, etc. But yeah, so there's a fair amount of that, especially with family medicine, but even with urgent care, you gotta get people to where they need to go.
True. How would to improve like heart health, what are some ways that you would?
So the main things, just kind of common sense that everybody knows. You don't want to smoke, drink, drugs. Those are all bad for you.
Yeah.
Try to get exercise, eat healthy diet, stay at a healthy weight. And then at some point, you want to check your cholesterol yearly and make sure that's not an issue, and make sure your blood pressure isn't an issue, make sure you don't have diabetes. And if you have any of those things, make sure you treat them. And that's really about all you can do. But most of those are pretty common knowledge. But they make a big difference.
Big difference, definitely.
Yep.
How often should like a person check in with their medical doc? Well,
so ideally, you'd want to go once a year. The younger you are, the less important that is. The younger and healthier you are, I should say, the less important that is. But usually once a year. The older and less healthy you are, the more frequent you'll have to go. 3 to 6 months.
What's up?
Your phone storage is full.
Has it not been recording the entire time?
I have no idea. Well, no, it's been recording for quite. Well.
Is the button still like?
It stopped at 4 minutes.
But at least you got the audio.
Oh wow, that's.
Oh yeah. Wait, no, keep going. You have
keep
the
going.
audio.
We have the
Who
audio.
cares?
Yeah, you got the audio.
That's what a podcast
Yeah.
is.
Should we like
The
just
video-
black out the I mean, the people don't really.
No, people don't
Look
watch
at the video. Yeah,
it's
two
just-
dudes sitting here.
Yeah.
Yeah, you're right.
Yeah, we're nothing to look at. No
No models.
offense there, but
You're
You called you ugly, Greg.
I get it, man.
We need to get some action into the podcast.
Okay. Anyways, so we've talked about patients sometimes lying, which doesn't happen too often, but it does happen.
especially associated with drug use or those kind of things.
For the future, what kind of excites you about the future of healthcare? Is there like AI or anything particularly?
So the AI is kind of a two-edged sword. It definitely has a lot of benefits.
Yeah.
I think some physicians I think worry about being replaced by AI, probably specifically radiologists, because computers can do a better job in a lot of cases of those. I think it would be hard for them to replace regular physicians who have to, internalize and see and think and do all that on their feet.
Yeah.
But only time will tell. But certainly there's a lot of help there with documentation, and even helping with just things you're looking up and wanting to find out so you can take care of folks. But it's interesting, and I'm sure you guys know a lot more about it than I do, but there's a lot of potential with AI.
Do you think like it could help paperwork in the future? Do you think it could?
Yeah,
I mean, speed
right.
things up definitely would be
Right,
great.
for sure.
Because I've talked to a few doctors, and I feel like a lot of times they get burnt out because of the paperwork. It's just
Yeah,
loads and loads of
and now
paperwork.
we call it paperwork still, but it's computer work. But yeah, it does. It wears you down.
Yeah.
Like the hospital's system is horrible to try to deal with. It takes me 2 to 3 times as long or more to document in the hospital system than it does at the clinic.
Really?
Yeah, because it's just so cumbersome.
Do things go faster on the computer? I'm guessing they should, right?
Than on paper?
Yeah.
No.
Really? Slower?
Yeah.
Wow.
Now there's more information and it's kept up better, obviously. It's faster to access, but to actual document it takes longer.
Longer, really.
Yeah.
Can I ask you more of a personal question about like the paperwork side of things? As far as like the paperwork and like the business side of things goes, like, would you consider yourself more of a businessman or more of a doctor?
Oh, definitely more of a doctor.
Yeah, because you started Sherwood Urgent Care, obviously, and that has a lot of paperwork. There's a lot to go in. There's a lot of connections to be made.
Yeah, you have to do it and go through it, and you learn a lot as you do it, and you make some mistakes. But obviously, I've got a lot more training and a lot more practice at being a physician than being in business.
Yeah, of course. Yeah, that's just because that's something that I plan as far as like finance. I plan to go into the finance field, and I'm thinking of starting my own firm one day. And there's
Definitely
a lot to
recommend
that.
it.
Yeah,
because you definitely have more invested, so you have more work ethic. You enjoy it more because
never
it's
thought
yours.
about that. It's more motivation.
Yes, a lot more
because,
motivation.
Yeah, it's your stuff.
Yes, and so you can learn a lot. And typically, you're going to make more money when you're in business for yourself than somebody else.
Yeah. Definitely. Has the rise of like telemedicine affected you much at all?
So not so much me, but our company.
Oh yeah. Sorry. Telemedicine is like whenever you meet with a medical professional online, and they kind of do it through there. But yeah, go ahead.
So it existed before COVID, but when COVID hit, it really ramped up.
Yeah.
But it's really more designed for things like psychiatry or follow-ups of some things. It's hard to do a physical exam when they're at home and you're not there with them. So it's kind of difficult to do acute care for sure. Some chronic care management could be done that way, or psych, or some follow-up stuff when you've already seen them. But acute care is pretty difficult through telemedicine. But the company does some telemedicine, but I haven't had to do it. It's been other people doing it, but it has played a part.
Yeah, gotcha. How long does it take to become a family doctor?
So typically you're going to do 4 years of college, and then 4 years of med school, and then 3 years of residency. So 8 and 3 is 11.
Wow. Yeah, that's long. So for like the young medical professionals or young college students who are interested in aspiring doctors is a better word. What would you say to them, or like what advice would you give them?
There's a lot of different things, but overall, probably, make sure they get some education about money and business, and think about being a part owner or owner of whatever medical business they're going into. Try to be more frugal than you might want to be, and just learn a lot about money, because you'll make good money, but it's not about how much you make, it's about how much you keep.
Yeah.
And so you really need to understand money and how that all works and what you should be doing, because nobody tells you that. And instead of coming out and, having a new Mercedes and BMW and a house like this one, you probably should
reinvest.
Go down for a little bit and stay down here for 5-10 years, and then start, because you're going to have medical school debt and
sure.
all those things. And so, but yeah, that's, I would say, one of the important things. And then just, first do no harm, and then try to take good care of people, treat them like people.
My brother told me that as far as like the money goes, so my brother's thinking about going into neuroscience.
Mm-hmm.
He's I think in the middle of residency right now. He told me that if you're just in it for the money as a doctor, it's not worth it at all after the med school. How true does that hold for you?
Pretty true, because as you guys know, there's so many things now that you can make really good money with, or at least make enough money to have a pretty good life with, without going through 11 years or more of schooling, and getting into that much debt. There's a guy here in town who mows lawns who does very well, bought $1 million house, and
I think I know who you're talking about.
Wife.
I think he's mowed our lawn.
Wife drives a very nice car. I mean, there's a lot of different things you can do, but medicine is one place I think you get a lot of fulfillment out, because you're helping people, and that no matter where you go or what you do, you'll always have a job and you'll always get paid well. And so that creates some safety and comfort in knowing that. But there's definitely a lot of things you could do that makes just as much or close, and you probably have more control over your schedule, and you don't have quite the risk or responsibilities to other people. Once you're in town as a physician for a while, it's hard to go anywhere or do anything without somebody asking you a question, or if you do business with somebody, they got your phone now, and so they're going to be calling you forever, asking you, hey, can you refill this medicine?
That's why I feel like having
so that creates some difficulty, and you don't get that when you're in other positions.
All right. I think those are all the questions I have for you today. If you live in Searcy, Arkansas, or any other places that have Sherwood Urgent Care, make sure to check them out if you have any problems. I think that'll be all.
Do you consider any specialties?
Did I consider specialties?
Yeah.
At one point, I thought about doing ortho, but I'm glad I didn't.
Really?
Yeah. Being on calls, hefty price to pay for yourself and your family.
Well, my dad considered. My dad went to dental school for a while, and then was
really?
this close, and then his dad was like, "Go to law school." So that was rough, but it's whatever.
Yeah.
But thank you so much for being here.
Hey, you bet.
Yeah,
My
it was a
pleasure.
great interview. Yeah. And I think you gave him some great ideas about med. Tell him to go a little bit more into business than he first thought. You need business, Greg.
Okay. I will take business classes.
And as you know, there's so many good books now that you can educate yourself pretty quickly without necessarily having to go through the classes. But there's so much to learn, and I try, because I didn't have all those, and so I try to teach Nicholas that kind of stuff. Rich dad, poor dad stuff. Buy an asset and have the asset buy your wants. You buy assets, your assets buy your toys. That's not always easy to do, but if you'll do those things and learn how to, whatever you do, also have a couple other side things that you do to make money, so that whether it's real estate or whatever, that you have other means of income, so you're not just got all your eggs in one basket.
Have you heard much about those courses that they try to sell you a course online, but they fake it till they make it kind of sit you hustler?
There's so much free stuff or just books that you can get they're really good. So
don't go out buying courses.
Don't spend a lot of money on education, because you can get a lot of it for free online now.
$50 monthly membership, insane.
The only beneficial part of going to an insanely expensive college is the pride factor, or
Yeah.
just like
Networking, I'd say.
no, that's I mean, yeah, but that's the people that you're networking with have the pride factor and are
Right.
getting there with that merit.
So yeah,
Yeah, true.
I think you'd say pride factor and networking.
Yeah.
Yep.
Yep. All right.
All right. Well, thank you.
Yeah, of course.